May is Better Hearing and Speech Month as designated by the American Hearing and Speech Language Association. This year's campaign theme is Communication Takes Care and provides an opportunity to raise awareness about communication disorders and the role of life-altering treatment. Did you know that 64% of parents are unaware of the early warning signs of hearing loss in their children? And 57% don't realize that without early detection, treatment takes longer and is more expensive. Furthermore, 70% of people believe that untreated hearing loss among the elderly is just a part of aging. Although it is well known that hearing loss is typical with advanced aging, believing that age-related hearing loss is normal implies that, since hearing loss is expected, it should be ignored. The truth about aging and hearing loss is that hearing loss varies among patients. Paige Holt, Doctor of Audiology at Lake Ear, Nose, Throat, and Facial Plastic Surgery, highlights some of the signs of hearing loss and explains the treatment options.
Some of the first symptoms of hearing loss would be ringing in the ears. Ringing in the ears, what we call tinnitus, is something that is a symptom of damage to the hearing nerve. Symptoms of damage to the hearing nerve are tinnitus and hearing loss, and the two of them usually go together. So many people will come in and say, my ears are ringing, and one of the first things we will do is test the hearing, because we want to determine, is there some damage or degeneration of the hearing nerve that can be associated with that ringing.
A hearing test consists of 3 components. There's air conduction, which is through headphones or insert headphones, speech testing, where we have them repeat words back to us, and bone conduction, which actually stimulates the hearing nerve. So all 3 of those components are required by law so that we can tell what type of hearing loss you have.
There are basically 3 types of hearing loss. There's what we call nerve loss, and the fancy term for that is sensory neural hearing loss. That is basically degeneration of the hearing nerve. The most common causes of degeneration of the hearing nerve are aging, exposure to loud noise, and family history can contribute. And that is permanent. We usually see that in your mid-50s or 60s, and we can correct that by way of hearing aids. Another type of hearing loss will be what we call a conductive hearing loss. Conductive hearing loss is what we see when usually we can have some medical intervention, and we would refer them to the physician for a conductive hearing loss. And then there is a case where we have what we call a mixed hearing loss. Part of the hearing loss is due to degeneration of the hearing nerve, part of it is due to a medical condition on top of that. And so how that would be handled is we would refer them to a physician for medical treatment to bring the hearing back as much as we can, and then we would correct the remainder of the permanent hearing loss with hearing aids.
For more information on the audiology services available at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Test Your Hearing story link icon on our homepage at yourhometownhealth.com.